Dr. Acton's getting bored over here. I'm going to let her answer a question. I'll start. You know, one of our challenges I expressed over the weekend when I was on TV has to do with the reagents. And I look at a chart every day that has our labs in Ohio, not just the public labs, but our university labs, our hospital labs. And I look at their capacity, and then I look at how many they're actually running. And one of the reasons that the number that they're actually running is much lower than their full capacity is because they do not have the reagents. And so over the weekend, you know, I expressed a concern about that. There are companies that are trying to develop new reagents, kind of new recipes for the reagent. And some of those have their application pending with the FDA. And so I encourage the FDA to, you know, do everything they can to speed up that process. After I talked about this on TV on Sunday on Meet the Press, I got a call from the FDA. They told me they were working on it. I know there was the particular company involved, I was told, made an amendment or provide additional information on Friday. So the more companies that we can get out there that are providing reagent so that the supply chain of reagent the hospitals don't have to worry about that supply chain, and that they know that they can run an unlimited number, or at least they can run up to capacity. That's going to make a big difference. So that's one. We're doing some self-help in Ohio State, and the health department are working very, very hard to come together, and what they're doing is they're creating more of the swabs and more of the liquid that goes along with that, and they're getting those out every week to hospitals around the state of Ohio. So a lot of good things are going on, but we're not there yet, and we got a ways to go. Dr. Acton.
Yeah, thank you, sir. So our governor is endlessly asking the question you ask, and we spent a good part of this weekend in discussions because we are looking to see if there's anything else we could do that is in our control to expand testing. And, you know, we have pushed everywhere. We're not the only ones that have these questions. Every state health officer in every state surrounding Ohio last night in a late night call with me faces the same wall. And, you know, one thing we did today was we were saying directly send to our labs, don't use LabCorp before because they were very, very behind, but they've caught up, they tell us. So we've loosened that our hospitals can send directly to LabCorp and Quest and the other private labs now, and we're going to closely monitor that to make sure that those times are not getting so far behind that we feel it's not helpful to us. Another thing we looked at over the weekend was our tiers. We actually have 3 tiers of sort of how to use scarce resources and who you should test. And we're really looking at that to see if we can tweak it. Could we get any more people under the roof of the scarce testing we have? But another strategy we have, we're also looking at deploying or creating strike teams and the ability to sort of go into places, get that test and run it back to our labs because we don't want any delays in how someone swabs someone. We have invented swabs in the state, and we are sharing that technology with sister states so that they could do the same. And then we're looking at, say you have an outbreak somewhere, so let's just use the Marion or a prison for an example. If one hospital lab or my lab only can do so many tests that day, how can we make sure to take all those swabs to a bunch of different labs and share across the state so that we maximally test people? So that is part of our sort of zone and regional preparedness structure that we've been building so that hospitals and labs are working together all over the state. So if there is this flare-up in one place where we just have to get those test results, but a lab only has so much reagent in that neighborhood, then can we move that test to a different neighborhood or a different community where they can run it? So it is that kind of flexibility that we're trying to build in to maximize, everything we're doing is to maximize our PPE, our testing. And this is a dance, the hammer and the dance, as we know. This is the dance we're in. of constantly trying to sort of use what we have to the best ability for Ohioans. And certainly the more testing we have, the better it will be for us going forward. Thank you.